There we go, 1 o'clock on the dot. Welcome, welcome, everybody. We are so happy to have you here today at the Kids Mental Health Washington webinar. So I know that we're in a webinar format, and so you can utilize the chat, utilize the Q&A. I want to say thank you to those that submitted some questions to our team ahead of time. We did take those questions and we incorporated them into our agenda. So we're going to go ahead and answer as many as we can towards the end. We've got a little bit of time built in for that, but we are going to jump right on in today. Again, thank you so much for being here. You're going to hear a little bit about our program origin. You're going to get to meet the teams that are doing the great work. You're going to hear about some of the great data and what is next to come. So again, go ahead and utilize that Q&A or the chat, depending on which functions you're using, to be able to ask some questions, make some comments, and we will absolutely look at those towards the end. So we're going to go ahead and kick it off. And of course, we really want to start with our welcome and our land acknowledgement. So before we start our meeting, we would really like to acknowledge all of the tribes of Washington State, since we are a truly statewide program, those that are federally recognized and those tribes that are still fighting to be recognized by the federal government. We do want to acknowledge the people and the communities that have lived on and cared for these lands since the beginning of time and continue to do so. This land acknowledgement is just one small step toward true allyship, and we recognize that, and we commit to uplifting the voices, the experiences, and the histories of the Indigenous people of these lands and beyond. And it is very with a heartfelt sincerity that we honor and thank the ancestors and leaders who have been stewards of these lands and waters since time immemorial, and we have committed to caring for the land, the waters, the plants, and the animals. And for those of you that are coming in from all over the state and even possibly out of state, we really encourage each and every one of you to learn about the Indigenous people who inhabited and care for the lands where you are now residing. So welcome, welcome again, everybody. And like I said, we're just going to jump right on in. So my name is Gina Capadu. I get to be one of the program coordinators for Kids Mental Health Pierce County. And it's my honor to absolutely be able to walk you through a really brief bit of the history of the Kids Mental Health Pierce County team and how the Kids Mental Health Washington model has grown and scaled and just some of the impact that we've had. So what you'll see here on this screen, I think is a really great quote that's going to kind of orient us to what I think many of you in the audience already know, is that a child's current behavior often reflects an essentially sane response to an untenable set of life circumstances. And I think it is fair to say that our kids across the state are really living through some untenable times. And so just to give you a really brief history, when we talk about youth behavioral health, we think about how it's gotten more complex, how it's gotten more acute, how it's gotten more frequent, and the ways that it manifests has really just changed over the years. One of the big, I think, historical land points that we always tie it to, of course, is COVID, right? But one of the things that we want to give some context for is for Kids Mental Health Pierce County, which I get to be a program coordinator for, our backbone organization is actually Mary Bridge Children's Hospital. So even prior to COVID, we were seeing a 400% increase in youth being seen in our emergency department for behavioral health needs prior to COVID. And so really, I think what kicked off Kids Mental Health Pierce County and saying, how do we bring the community into youth behavioral health, actually started when we had a youth that was at a intensive services home in King County for intellectual and or developmental delays. And the behaviors and the mental health was so extreme that this youth actually came from King County to Mary Bridge Children's emergency department to be seen there. And what ended up happening is that this youth lived in the emergency department for weeks, which is not a great experience for kids that have to live in emergency departments. It led to hundreds of thousands of dollars of unreimbursed costs. There was staff injuries, and we just looked at, there has to be a better way to serve kids, to be able to partner with systems. And so from that, what actually happened was there was an investment from the Mary Bridge Foundation, so that we were able to hire our very first program manager, who is now our director of Kids Mental Health Washington here. And we were able to hold our very first youth summit. And that youth summit was really intentional in how do we bring all of the systems, all of the partners at the table to say, what is the landscape of youth behavioral health and what can we as a community do? We can't make materials or funding materialize overnight, right? But what we can do is figure out how can we coordinate, how can we collaborate, and how can we all work together to be able to serve youth and their families. And so out of that summit of where we had dozens and dozens of partners, partners, we actually had some community agreements and some strategic initiatives that came out of it. And the group title became Kids Mental Health Pierce County. And that was really a coalition of all the different system partners, whether it was DCYF, DDA, community-based behavioral health providers, and others that came together and said, we are going to partner together to serve school-aged youth. What was also really important to this group was that it was going to be any level of acuity for behavioral health, any geographical area that they lived, and any kind of resources that were both going to be clinical or non-clinical. And it was going to be regardless of any type of insurance status and any kind of documentation status. So what we wanted to know was that regardless of wherever these youth are, whatever systems that they were currently involved in, that there's going to be coordination and support for these kids. And with that, one of the foundational pieces that we looked at, we also love this slide here, is kids don't exist in vacuums, right? So when we're going to look at how do we come together as a community, bring community into youth behavioral health supports, we have to look at the different aspects of a youth life, right? And so that's going to be what's going on at the societal level, what's going on in their environment, what's happening around them in their communities, of course, within their own family setting, and for them as an individual. Kids are not going to exist in silos, so it's going to take a multi-level approach. What we also want to focus on is that it has to be a cross-system collaborative partnership, because we recognize that this cross-system model is going to be necessary to serve these kids because, again, kids don't live in silos. And so not living in silos, it's really going to take all of us as partners to serve kids and family, because there's not one system that can or should have to address all the needs of youth and their families. So when we had that summit that I referenced that Kids Mental Health Pierce County kicked off with, these are some of the partners and more that are going to go into serving in collaboration youth and families holistically. So that's kind of the history. What is this model, right, that is rolling out across the state? There's a couple of pieces, but ultimately all of it is designed so that there is a process in place to support youth and their families wherever they are, whenever they are, with whatever capacity that they need. It really is intentionally a no wrong door approach with a multi-layer partnership, so that it's not about just having a program and a process, but making it accessible, adaptive, and responsible. So those component pieces are the ones that are here listed on the screen, that they're braided together. And so that is a high-level steering and action committee that's going to be able to coordinate those local resources and collaborate on some community initiatives. It's also going to be multidisciplinary team meetings that are very intentionally youth and family centered, that really have a wraparound collaboration approach that brings all those local great resources, gems, and partners together to the youth and the family to have a tailored action plan of supports and resources that families can be connected to. There's also going to be a website that each of these regions has that has up-to-date local and community-based resources for kids and their families. One of the most powerful quotes that we hear from the kids and families that we serve is that they don't need another door to an empty room. So what's really critical is that these websites are resource hubs that have current information about all the great things that exist for families and kids in their community. And with that, there are these Kids Mental Health Washington teams that are across each of the regions, which you're going to get to meet, and you're going to get to hear about some of the great stuff that they've got going on that are directly providing behavioral health navigation, care coordination, and community consultation. So what I would love to do is, now that we've kind of talked about what the model is, what the history is, I want to talk a little bit about that expansion. And this expansion is actually a result of legislative funding that came out of the governor's proclamation of youth behavioral health being declared an emergency, and Kids Mental Health Pierce County having this model, these model components that we just reviewed, of being really effective ways to address youth behavioral health. So that model has been able to expand across the state in partnership with the Healthcare Authority and Developmental Disabilities Administration. And you're going to hear a little bit about and from each of those partners. So what this is going to consist of this expansion across the state, is these partners with the Kids Mental Health Washington teams that are standing up across Washington really are going to be provided some technical assistance and support to be able to stand up this model so that communities around the state can take the model, but they make it their own so that it fits the culture of their community, the populations, the resources that they have, so it can be really tailored to being effective to what kids and families need locally. So with that, I want to turn it over to our first partner who is with us today from Developmental Disabilities Administration.
Hi, Gina. Thank you so much. My name is Megan Hopkins. I am the Youth Behavioral Health Program Manager with the Developmental Disabilities Administration of DSHS. And we're so glad to be a part of this work from the ground floor. It's wonderful to be able to collaborate with our partners at Healthcare Authority and all the Kids Mental Health Washington teams to build this system so that it addresses the needs of all youth in Washington. DDA is building infrastructure to be able to collaborate actively in the program. We have several positions supporting the Kids Mental Health Washington team. Shelly Bogart is my supervisor. She's the Community Systems Integration Unit Manager. Um, and then my position is dedicated to working with Kids Mental Health Washington. And then we have 3 youth behavioral health specialists, one for each of the DDA regions that overlap with the Kids Mental Health Washington teams. We have 2 of our youth behavioral health specialists hired. One has already begun. The next starts in April. And then our third will be, the position's actually posted right now and they are reviewing applications. So we are so excited for having these staff on dedicated to really developing relationships with our partners at Kids Mental Health Washington in all the regions, as well as with community providers and the other teams that become part of the coalitions that are built through this program and this model. So one of the things that we do is we partner to support youth with developmental disabilities and their families in navigating service systems. And we have our DDA eligibility and services guide. So sometimes we have supported Kids Mental Health Washington teams. Oh, Gina, I think we just lost our PowerPoint.
How's that?
There, that's better. Thank you.
Yeah.
Um, so our relationships with our kids, excuse me, mental health Washington teams have supported more efficient collaboration around questions of eligibility and coordination of services. For example, DDA services can be utilized for sensory tools and home modifications. Services like cross-system crisis planning, staff and family consultation, and respite are often complementary to the mental and behavioral health treatment that youth receive through their medical plans. So having these relationships to be able to do cross systems communication, we're already seeing an impact for more efficient collaboration. The other focus that we have at DDA is addressing the barriers to service, including developing and disseminating resources to increase provider confidence in serving youth with developmental disabilities. So we are really excited about the potential data sharing that is possible with our Kids Mental Health Washington teams who are seeing the barriers firsthand that youth have to accessing services in our state. And we're excited to be able to turn those barriers into opportunities to grow the possibility of serving youth. Thanks so much.
Awesome. Thank you, Megan. And I'm so grateful that we get to have you here because, really, as Kids Mental Health Washington was being designed as a model and it was being expanded across the state, it was so important to have DDA be part of that rollout from the very beginning because so many of the youth that we're seeing are actually those that really need the most wraparound supports, right? So these are the youth that were coming to the emergency departments to be served. These were the community partners that wanted more training about neurodiversity. So it was so critical to have that partnership from the very beginning. So, what I would love to do next is actually turn it over to our other partner that I prefaced. Our friend Edward from the Healthcare Authority is going to talk a little bit about how financially this all became a possibility and what that expansion has looked like over a tiered process. So, Edward, I turn it to you.
Thank you, Gina. Edward Michael with the Division of Behavioral Health and Recovery, Healthcare Authority, and I am the Kids Mental Health Washington Administrator. So here, year one, in 2021, the legislative session, lawmakers funded the existing Kids Mental Health Pierce County program and provided funds for them to provide technical assistance for the rollout of what is the Youth Behavioral Health Navigators across the state. And it's now being referred to as the Kids Mental Health Washington. In the first year, they funded 3 regions, Salish, Greater Columbia, and Southwest. And then in the following fiscal year, funds were set aside for North Central, Spokane, and Great Rivers. That's back, Gina. All right, it keeps flashing, Gina, just as a side note. So North Central, Spokane, and Great Rivers stepped up to start their implementation July 1 of 2023. And it's been very exciting to have them come on board. And then in year 3, King and North Sound will join the Kids Mental Health Washington implementation. And of note, Thurston Mason was slated to start in year 3. However, because of the ARPA funds, they were able to start earlier, and they said that they were more than willing to come on board. So it's been a pleasure to have Thurston Mason on board as of July 1st of 2023 as well. And back to you, Gina.
Yeah, thank you so much. I really do appreciate it, Edward. So I want you guys to kind of take extra note of this map because we're actually going to review it a little bit later towards the end of our presentation. This map is actually your best way of getting connected to your Kids Mental Health Washington teams, because the map that we have on our website that we're going to show you and we're going to provide the link for is really actually interactive. You click on the county where you're looking for resources to support youth, families, get some education, get engaged, and that will take you directly to that site so that you can access not only the resources that are on there, but be able to get engaged for what locally you're looking for. And some of the things that you're going to see on that website are really abundant. And of course, because this is tailored to every region has different resources, cultures, people that they're serving, you're going to find a variety of different information. But some of the things that you can find is information about crisis services, intellectual and developmental disability resources, parent supports, information for inpatient, outpatient, any resources locally for substance use disorder, finding providers, and then of course, how to get connected to those teams. What I would love to do is actually turn it next to our regions so that you can hear from the teams themselves that are actually doing the work. You can hear a little bit about how it looks different for each community that they're serving because of different populations. Some are rural, some are more urban, some have one county like we see here in Pierce, others have 9 counties like our friend in Greater Columbia that you're going to hear from today. And just know that's going to look a little bit different across each of the regions. So as Edward had addressed, there were a tiered rollout process that took place. So we've got some regions, our first 3 that came online. We've got some that had just launched last year, that's 4. And then we've got 2 more that are coming, our friends in King County and our friends in North Sound. And so with that, I would love to turn it over to our first partner that we have, and that's going to be our team over in Greater Columbia. I'm actually going to kick it to them first. So for our friends in Greater Columbia, can you just talk a little bit about what it's like being one of those first providers that were able to stand up this program and some of the wins that you've had locally? We'll give it a second just for people to get off of mute and to be able to come on virtually here. I can also pass it next to maybe our friends in Salish. So our friends in Salish, Heidi, I see that you're on the call. If you can talk a little bit about what it's been like for your team, that would be awesome.
Sure. Hi, everyone. My name's Heidi. I am a program manager with the Salish, BHASO. And the Salish region includes 3 counties, Clallam, Jefferson, and Kitsap. We launched on August 1st, 2023. And that was it's been an exciting time. We are really getting involved with the community, building relationships. And we recently had a success. We had an in-person MDT at a local school with approximately 12 participants. And that turned out really well. It was very valuable. And everyone involved was happy to be in person. And so we are going to continue to make those available as much as possible in person. And lastly, we have created a youth application that is available on our website so that youth can apply to be on our steering committee. We are looking for 1 youth from each county we serve, and we already have 1 applicant. So we're in the process of working with them and setting up a meeting with that youth and our selection committee.
Awesome. Thank you so much, Heidi. I really appreciate that. It's just been so cool to have also not only the great work that's happening in Salish happen, but because you guys were one of the first regions that came online, to be able to have that mentorship for other regions that are coming online to learn from you. You get lots of great kudos from the other teams just for how generous you've been in allowing people to sit in on your steering committee meetings, just kind of the vision you have of having that paid youth voice participate in the model locally. So just really great opportunities for those other regions to learn from and with you. And I know that we resolved a technical issue. So Meredith, could you talk a little bit about some of the cool stuff going on in the Greater Columbia region?
Sure. Thanks, Gina. Sorry, everyone. Can we hear me now? Wonderful. Okay. Well, thank you for having us today. We at Greater Columbia are just really excited to keep promoting this program. As Gina mentioned, we do have a 9-county region. And so we have been working to develop our steering committee and rolled out in Benton and Franklin counties initially. And we did recently expand into Walla Walla and Columbia counties. So we're really excited about that. We're working on launching Kittitas County on April 1st. And part of what we really like to do is participate in community events, and especially in the regions as we're launching. We do have some events coming up in Walla Walla, Columbia, and Whitman County as well. It's been really great to go out to each community and interact and really get to know the people that live there, the services that they provide, and just kind of, every area kind of has its own unique cool thing about it. So it's been really great, and we're excited to just keep expanding in Greater Columbia. We do continue to work on our website and expanding the resources for each county. We continue to update our Find a Provider tab on our website. The Find a Provider tab for us has been a partnership with the ESD 123. They were trying to maintain finding providers in our area and maintain an updated provider list with wait times on their own. I believe it was just 1 or 2 people from the ESD that were working on it whenever they could. We partnered with them, and so now we have, I can't remember how many people we have working on, maybe 8, including us, including Roberta and Zach, who work to contact providers in our regions and talk to them about their wait times, who they take, what insurance they take, and they do continue to update that information every 2 weeks. So our goal is that we will continue to provide that and continue to partner with different organizations or ESDs in each region that we expand to, so that we can keep that availability of services up to date in each county that we move into. So we're really excited about that. We also provide some ongoing case management for youth that are involved in multiple systems with complex needs, even after the MDT. We participate in the ECHO IDD program, which is a wonderful program, has such great information, such great people. And we did have the opportunity to present on a youth, got some great information, feedback, and support in that process. So we're really excited about that. And continuing to participate in those echoes. I believe they're twice a month. So that's a really great benefit of being in this group, as we found out about that. I guess for us in Greater Columbia, we've really found that there is a lot of power in bringing families together with so many supports in a real strength-based meeting. Even though the families might be experiencing some crises or there's things going on, we really, and I know the other regions as well, really try and make the meeting about support and services, and maybe trying something new, creative thinking, trying to get some out of the box solutions to some of their concerns. And I think families see that when they see the people that are trying to help them, they see this meeting that has 20 people in and around their community that are really trying to support them. I think as long as you're making it a supportive meeting and you're trying to really draw on the family and the youth strengths, I think that can be really positive and wonderful for the family. I think that maybe can give them kind of a breath of fresh air and kind of a reason to kind of continue walking down this path. Because I think for those families that are struggling, I think sometimes you can feel hopeless and alone, and we don't want them to feel hopeless and alone. We want families and youth to see that there are so many people out there. There's so many awesome agencies and organizations and advocates out there that are really working to make our mental health system better in Washington State. And I think the more families and even providers see that, I think, we're just going to have more success. So I think that's been a really big benefit of Kids Mental Health Pierce County. And I know that that's how they try and, that's how we all try and run our meetings. And so I just really think that that's a great strength that we have. And I'm just really happy to be here, and so thankful for all of our colleagues and all of our partners, because we do definitely learn from each other and continue to grow with each other as well. So thank you so much.
Awesome. Thank you, Meredith. And I would love to actually turn it to one of our regions that launched last year. So our friends in Thurston and Mason, if you could come off and talk a little bit more about what you've got going on as you kind of get stood up, that would be wonderful.
Good afternoon. Gina, can you see me? I
can see and I can hear you great, Gary.
Okay, great. Hello, everyone. I'm Gary Yens, Children's Care Manager at the Thurston Mason BHASO. And Kelly, do you want to introduce yourself?
Sure. I'm Kelly Monti, and I'm the program coordinator with the Youth Navigator program, which is with Gary at the ASO.
Yeah, and so we're still in early stages of implementation. We've been very intentional about using a collaborative community engagement process, which takes a little bit longer, but our hope is on the back end that we'll have much better community buy-in, which will build a stronger program and really tie into our existing system of care. A couple of the highlights: one, who you just met, is Kelly. We hired Kelly as our Youth Navigator program coordinator in November, and she hit the ground running and is doing an amazing job. And then the other highlight is that we also convened a group of longtime committed system of care folks from our community, a handful of people that were willing to commit to meeting with us 4 hours every 2 weeks for the last 3 months now, in really just building out the community, the program structure, and preparing for the community planning process. And I'll let Kelly share a few of the highlights of things that we're working on currently. Thanks, everyone.
Yeah, so the small team that we put together, we call our advisory team, and together we identified and contacted potential steering committee members, and have commitment from about 40 of them that we're anticipating will appear at our meeting next week. So we're having our first community steering committee meeting next week, and we have lots of representation from various systems, as well as youth and caregivers with lived experience. So we're really excited to get started with that. We also created and sent out a strengths and needs survey as sort of our first step in a gaps analysis process, and our using that to help guide our program development as well. So I'm doing a lot of data analysis and evaluation, and we'll be sharing that information at our steering committee meeting next week. Looking forward, we're in the deep stages of prepping for next week, but we want to plan to continue our gaps analysis process using other data available. And I know we talked earlier about, using this program to navigate some statewide data, and we're excited about that part of the program, using some census data, some key informant interviews, and other follow-up that we plan to do with our community members. we're hoping this will help guide our target impacts and strategic plan. And then we're planning to develop some small groups out of our steering committee to work on addressing the key components of this program, like the youth boarding in the ERs, and working on our website too. So we are excited about everything to come.
Awesome. Thank you, Kelly and Gary, so much. I would love to turn it next to our friends over in the Spokane region. We're lucky enough to have Stephanie on the call. So, Stephanie, if you can give some updates on what's going on with your region, that'd be awesome.
Yes, hi, thank you, Gina. Everybody, my name is Stephanie Sorensen. I'm the program manager for our Youth Navigator program, and I work with the Spokane County Regional Behavioral Health Administrative Services Organization. And we have just hired our care coordinator, case manager here this past month, and we'll be hiring for our navigator next month. So we're excited about that. Spokane, so for the past several months, we've been working very diligently just to create partnerships, building our steering committee. We've held 3 steering committees in the past months, and we're holding our next one next week. And we're also really excited to announce that we will be getting our first referrals and opening up our first referrals starting next week. We're going to be doing a soft launch, and so we're going to be getting hospital direct referrals before we grow the referrals to be directly from youth and families. But we're just very excited to be building these partnerships, creating action items, connecting resources, and really get going with the program. And that's what I've got.
Well, you're getting lots of hearts from the audience there. So I think that love is definitely being reciprocated.
Thank you.
Thank you, Stephanie. So I would love to turn it next to our friends in Great Rivers, another region that got to launch last year that's got some momentum they built upon and some cool stuff on the horizon. So I'll turn it over to Carrie and Mandy.
Thank you, Gina. Good afternoon, everybody. My name is Carrie Googe. I'm with Great Rivers BHASO. I am also a program manager for the Youth Navigator program here. I'm going to turn it over to Mandy real quick for an introduction. Potentially. Oh, I can't hear you, Mandy. You know what? I will introduce Mandy. Mandy Goodman is our newest, no, don't worry about it. Mandy Goodman is our newest hire as our Youth Navigator Program Coordinator. We're super excited to have Mandy as the Great Rivers program has literally just went into contract last year. So we're part of the second year pilot. We hired Mandy in December. And so we're super excited to have that as an update today. Just a reminder of the Great Rivers region, we cover 5 counties: Lewis, Cowlitz, Wahkiakum, Pacific, and Grace Harbor. And an update that I have for you all today and where we are in our program is that we had our first official steering committee meeting in January, and we are in the process right now of still building up our steering committee to try and make sure that we have the representation needed to get this program up and running. We still have not decided yet where we will do our soft launch, but as we are trying to get more partnerships as part of our steering committee to make that plan, then I assume that's going to happen very soon. Another update that we have is that we are in the process of putting our website together. I think the biggest hurdle that we have to go through is pulling together all the resources that are actually available in our 5-county region, which is a very interesting project in itself, but very exciting because it would be absolutely amazing to have a one-stop shop where you can go to actually find all of that information. So we're very excited about having a resource like that for everybody. We are also in the process of just advertising as much as possible, bringing awareness to our communities, the meetings that we attend, partners that we have, and sending invitations like this so that we can send more awareness that this program is coming. Though we're not ready to take referrals just yet. We're on the track to do so hopefully soon, and we're only going to be able to achieve that with partnerships and support from our communities. So with that said, we are very much open to anyone who is feeling that they would like to consider, as a system partner, joining our steering committee, or even if you're a parent advocate and you're on here and you're interested and you're part of our region, please reach out. We're in that process of building and trying to form those relationships. So I am going to plug that in here, as I see we have a very impressive audience right now. So if there's any questions, Gina will have contact information for all of us. So thank you.
Absolutely. And there's a couple of the regions that it's always impossible, right? When you've got a team this big to be able to find a time that works for everybody. There were some conflicts, but I was asked to share out a couple of really great updates for some of our other regions that couldn't be here. So one of them is our friends in Southwest. And so one of the things that they're really celebrating is that they're getting a high number of referrals every single month. And what that indicates is that the community has really bought into this process, that they really want to make sure that they see the power of community collaboration and the impact it has on getting kids and families connected to services, being able to work in partnership on some of those community initiatives together. And so one of the things that the Southwest team is really proud of a very long list, of course, is that they've been able to have a lot of success working with their rural communities and getting kids connected towards resources. We know that electronic access can be an issue. Families just have to logistically drive further to be able to get resources. There's fewer resources in those rural areas. So that's something that they're really proud of, is being able to focus time and energy and making sure that those families feel heard and provided with, and that also the providers that are out there feel like they're being supported and there's extra capacity there. They also wanted to call out just some of the great partnerships that they've had with schools. Schools are huge resources in providing referrals. They've done a lot of targeted outreach, and they've actually also done a lot of training. So those are some of our early adopters that have been able to bring this program truly statewide. What I would love to do is actually turn it over to our last two regions that are going live as of this year. So one of our regions is King, and I see that we have our friend Sarah on the call. So I'm going to turn it over to Sarah, and then I'll speak a little bit about North Sound.
Hi there, Sarah Waters. I'm the Children and Youth Care Manager with King County. Not a lot to report yet, just that we've been observing some of the other regions. I'm very grateful to have the opportunity to do that, gathering information, and we're in early discussions around what this is going to look like for King County.
Awesome. And I just want to give a huge shout out to our King County partner, Sarah, that's on the call, because even though they don't officially launch till July, they have been absolutely willing to jump in early. They're meeting with our learning collaborative that we do internally, where all of the regions, Healthcare Authority, and of course our Developmental Disabilities Administration are learning from each other and with each other. So they've been really active in shadowing everything from a multidisciplinary team meeting to a steering committee meeting and everything in between. So just knowing that they're ready to jump on in has been so exciting. And another one of our regions that wasn't able to be here today, but is also coming on the horizon, is our friends in the North Sound area. So they asked me to share that they've been attending the Learning Collaborative, just like I spoke to with our friend Sarah at King County, and a variety of other meetings, just to shadow and be able to have that information as they hit the ground running. They also know that they've been reaching out to the regions directly to ask about some brainstorming ideas, get a general framework on, what they can learn from regions that have rolled it out as they implement it locally. And they just wanted to make sure everybody knew that they're still available, as always, to talk with any folks that are looking for support navigating the system and coordinating some services. I will say, even for the regions that are not online yet, or those that just came online, we were already getting referrals through our Kids Mental Health Washington of families looking for support. And even if the program is not officially live in those areas, I have found our King County partners and our North Sound partners to be so willing to say, absolutely, send them our way. We're going to go ahead and get started with whatever supports that we need. The last region that I absolutely want to call out that has actually come on live as of last year is our North Central partners. So some of the things that they wanted me to cover, just because they too had some conflicts, was they have been so intentional for their community rollout of really rolling out with the tribe with the soft launch. So as they're looking at getting those MDT meetings and those steering committee tasks up and running, that they're really wanting to do this with a focused priority on working with the tribal community, both the providers and serving those kids and families. They had a highly successful kickoff presentation that they did for bringing this program to their community on February 15th, so pretty recently. And you guys, they had a whopping 95 community partners across a really large geographical area that was in attendance. And from that, one of the things that have actually come on is, as of February 19th, their website is live. So there's a ton of resources. There's opportunities to do referrals for consults for complex behavioral health for youth. And so that's coming online for the soft launch is actually going to start on March 18th. So this actually just went live, and it's going to be in coordination with their first referral having come from the Colville Confederated Tribes. So they're really excited that they've got their soft launch that has been focused with those tribal partners. And they're also very excited to report that they have a core MDT team, just kind of like Gary was talking about, a team that meets really intentionally to kind of plan what this looks like. And so they're having their kickoff meeting of the community initiatives and partnership moving forward as of April 4th. And they are going to be meeting on a weekly basis to make sure that they're growing what resource coordination and partnership looks like. So those are all of our regions. It was important that you got to meet the faces of the great people that are doing the work with you and for you in the community. One of the things that we also like to do after we have this discussion and we hear from all of the partners is we've got some frequently asked questions that pop up. So one of the things that we hear a lot is, there's lots of great programs online. How is this different from others? And the ones that we hear most directly is usually the CLIP program, WISE, MRSS, and FISPERT. And really, when I asked, our team partners here of kind of like, what does that difference look like for you locally? What's really important is that the regions have been so intentional and strategic about reaching out to those system partners and being able to learn what those services look like locally and how those existing partners actually think this could be an opportunity to collaborate and complement each other. Because what we want to make sure happens is that we are being effective and efficient in how we're partnering. So it looks a little different in each community, again, just because every community is going to have different resources. So if you've got some questions about that, I highly encourage you to reach out, use the website, drop your information in the chat, and reach out to the team members here that you just got to hear from. Another question we hear a lot of is if this is about youth, it should be for you. So for youth, with those that have lived experience and those that don't, how are they engaged in this initiative from the planning, the development, the launch, and the implementation? I know our friend Heidi offered to speak a little bit about this. Can you elaborate a little, Heidi, on what you spoke to before about having that paid youth voice at the steering committee level?
Sure. Yes. Thanks for reminding me. It is paid. I forgot to mention that. So youth that do make a commitment to come into the committee are paid $60 each time they attend. And the intent of having the youth join was for them to speak up and give us their perspective. Oftentimes we find ourselves surrounded by other professionals talking about what is best for children, our youth, families, without really getting their voices heard. So that was what we are attempting to do with the youth applications. And it's a really good opportunity also to get the community involved. We have some pretty rural areas, and we've been able to reach out in Jefferson County, for example, and engage a couple of teenagers that we hope to see applications from. So we like to talk with, not about, not around, but really engage that group, that party.
Absolutely, Heidi. I couldn't have said it any better. So thank you so much. And I think, of course, it's going to look different for each region about how they're incorporating youth. I think another thing that's really big is not just bringing youth to these programs, but bringing the programs to where the youth are, right? Those are going to be school settings, boys and girls clubs. And that's where the power of community comes in, is the best way to be able to partner with and serve youth is to go where they are. And that's going to look different based on cultures, resources, geographical layout. And I think the teams all have really unique ways that they're doing that locally that really is targeted towards what works best for those kids. And of course, as soon as we get a question about, well, how are kids involved in this? I think the next question that we get is, how is parental involvement supported in the service approach? And I think there's a couple of things. One of them is those multidisciplinary team meetings that we've spoken about, where we've got a range of community and system partners in one space, virtually or in person, that kids and families come to say, these are the needs that we have, this is what we've tried, and this is what we want. Is by having that one space, every single one of those meetings is centered with having parental involvement there. So the parent is present at 100% of those meetings, because just like we talked about, if you're going to have a meeting with somebody, it needs to be with them in the room, not just about them. So I think that's one piece that's really key. Another thing is we lean really heavily on our peer partners that are across the state. We've got organizations that are local and statewide that are part of our steering committees of our MDTs, and just making sure that that voice, that experience is centered in everything that we do. I think that's another common question. And the last one that we get a lot of is, okay, so what's the new opportunity that's coming from this program? And there's a few pieces that have been touched on. So one of them is we're collecting data across the state. I'm going to get into that on the next slide here. But what's powerful is that these metrics were created and adapted by the teams that are doing this work, because they're the ones serving the community. So they know what they want to be able to capture to say, this is the landscape of behavioral health today. And this is where we can start looking at policy, resource information, and even legislation about this is how we need to and should be serving kids and families. I think another thing that's came out of that is, Kelly and Gary talked about it a little bit for their Thurston Mason region, is just doing some gaps analysis. Is we collectively as community partners know the gaps that exist in our communities, but by all of us collecting the same information at the same time, we're able to have a bigger, broader picture that also has a lot more depth and detail. I think the other thing is just being really creative about the supports that are in the community. When we talk about kids' behavioral health, it's not always going to be a clinical recommendation. Sometimes it is meeting a basic need. Sometimes it's arranging some proactive social skills. And it can really also go all the way up to, of course, like those intensive placement options. But when I talk about data, this is one of the things that I get to absolutely geek out over, is what are the regions collecting and how is it being used? So I wanted to point out that we have both qualitative and quantitative data that is being shared and created across the state. And there's a few different things that are being collected. So this is on both a monthly basis and a quarterly basis. And really what's being looked at is, what is the age of the youth that are being served? What is their insurance? And not just, are they Medicaid, are they commercial, or are they something else? Actually breaking down what are the different providers of insurance that these kids have. If they don't have it, helping them get connected so they can just really exponentially have better access to these different types of behavioral health providers. We're looking at the date of contact so we can track when there's going to be different trends of different needs. We're looking at what kind of other system involvement these kids have. Are they involved with juvenile justice, with child welfare, with the Developmental Disabilities Administration? So kind of looking at where that intersectionality is happening. We're also looking at, where do these kids live geographically, so we can find where are those champions, those rock stars that are doing some really innovative stuff that maybe is on the quieter end that we don't get to hear about, and how can we elevate and bring capacity to it? Or where there's some hot spots that we can absolutely address, and target some training towards providers, community members, and others that could need it. And I think another thing we're looking at is, what kind of disposition do we have for these youth? What kind of presentation do they have? What needs do they have? And what kind of resources have been really highly effective in addressing some of those things? Other things that we're looking at is, we've talked about those MDTs, is of course we're going to track how many MDTs we're holding across the state, but we're also going to look at how many have been requested in general, because when we bring community providers together with a family, we want to be really strong stewards of those that are volunteering their time to come up with recommendations and connections for kids and families to access. And so there is just as much value in being able to provide some behavioral health navigation through the website, through these Kids Mental Health Washington teams, and getting connected to just that resource that they were looking for without bringing providers together, as there is when they come to the table. We're also looking at how often we're holding these MDTs across the state. Since this is really a program that's tailored to each community, it does vary. So there's some MDTs that are now happening in person. For the most part, they're actually virtual, and it's a range. So some of them are on an ad hoc basis, and other are on a set cadence. And what's really cool is that whatever the youth's need is, we've been able to pull partners together really quickly. So from the time of a referral to actually hosting an MDT with a full panel of providers and system partners that come together live with the youth and or their family, it has happened where we've had, within 48 hours, we've been able to bring 24 partners together to make some recommendations and referrals happen. I think the other thing that we're tracking, like I said, is not just the age of those kids that are being referred, but also the purpose. Is it about safety strategies? Is it about outpatient navigation? Is it about care coordination? So we're looking at some of those. But what we know is from every MDT that occurs, we're having about 1 to 2 dozen recommendations, and we've got an outstanding success rate in for both the youth, the parent, and or the provider that comes to that table every time that we've got people that are learning of a brand new resource that they didn't know existed. And these are clinical ones, like we've talked about, but also those non-clinical recommendations. And the recommendations, while this is Kids Mental Health Washington, it's not just for the youth, it's for the family as a whole, because just like that early slide showed, nothing happens in a silo or in a vacuum. I think the other part that's really critical of what's coming out of these MDTs is that we're looking at making sure that these services are culturally and linguistically responsive for the youth that is being served. And when I talk about culturally responsive, it's not just traditional demographics, it's also being inclusive. And we've seen MDT recommendations have things like animal therapy, yoga, naturopath referrals, and others. We're also looking at how can we rope in those partners that could do maybe like a school special assistant plan, whether it's an IEP or a 504, getting connected to some school advocates. And also a lot of families don't know that they can get access to some behavioral health navigation through their insurance case management. So making sure that we've got those MCO partners close at hand so that they can absolutely partner with this youth and their family. And then also just being aware of the crisis teams and the hotlines that are available locally so that youth, whenever possible, do not have to go to an emergency department to get care that they'd be better served with in the community. And also just those recreational partners that provide so many just important and successful preventative services that are mentoring programs, our Boys and Girls Clubs, some of our LGBTQIA support groups, and then also looking at some training and opportunities for family, whether it's going to be some parenting classes, whether it's going to be some psychosis training, just whatever that need is going to be. So these Kids Mental Health Washington teams are rock stars. They're connecting families to all these different types of services. They're also doing additional partnership programs, kind of like attending those IEP programs, IEP meetings, excuse me. They're helping assist families with Apple Health applications so they can get connected to these behavioral health services. And I think it just really goes to show that it takes all of us engaged in this work to be able to foster those outcomes. A couple of things that also I want to keep at the forefront is that with this work, really it is about centering youth and their family voice. So I called out again before, but I'm going to call out again that for every MDT that is held, 100% have had parent caregiver attendance because we need to be having these meetings with and for families. And these are some of the quotes from our families that have been able to attend our MDTs that I think really captures the power of this space. We can't always make a resource appear overnight, but what we can do is be able to facilitate the power of having 1 to 2 dozen community partners show up for a kid and a family and say, we are here for you, and provide that hope, be able to build that relationship between partners, and just really bridge that education of what kind of great resources do we have. And some of the things like you can see here on the screen is one parent that is part of a steering committee that we have across the state says, I believe this is a great approach from a parent's perspective. This is 100% needed in our community. So we're hearing that from the families. Or we had a parent that attended an MDT that said, thank you to everyone for being here when my daughter and I needed you. I don't have words to express how much weight has been lifted from both of us. Having this resource to help point us in the right direction and come up with ideas to get my daughter on the right track has been invaluable. So I think those quotes really drive home some of the impact. But if you also have maybe the other side of your brain that looks at, how do we measure impact? I think there's a couple of pieces that we really wanted to draw attention to of just, this is the power of community, and it's experienced at the direct service level. It's experienced at the community level with the steering and action committees. And, there's just so much that these different teams are focusing on. And these are some of the outcomes that we've had is across the state, there's some 0.1% behavioral health tax dollars that are coming online. And these teams have provided through their steering committees collective letters of support of being able to funnel resources to where some of those gaps are. I know here in Pierce County, one of the things that we got to do through community collaboration was we actually got to stand up a second crisis team that focused on not just the Medicaid population, medication, which we had a team for, but those that were non-Medicaid as well. So I think that's a win. I think our friends in Greater Columbia have done some really cool stuff with working to bring the Hope Squad to some of their school-based programs. So increasing just evidence-based preventative services has been something that's been a success. We've also had, like our friend Heidi shared in the Salish community, making sure that this work is done in partnership with youth by having them be part of their steering committee. I'll also give a shout out to our friends in the Southwest region, is that they have been facilitating through their steering committee access to telehealth hubs so that there's more capacity for serving kids, families, and providers when they're in a more of a rural area that doesn't have that broadband capacity, right? Or we're looking at when really our origin of this model is being able to reduce youth admissions to emergency departments, being able to just say that we as a collective community
Oh no, it looks like Gina froze. Did she freeze on everybody's end? Wow, what a,
Yes.
the word she was saying was absolutely amazing in that closure, and really a sentiment. I think of seeing all of the thumbs up and all the hearts that are coming through, and just being able to sit back and witness just the questions and answers and all of the updates from the region. And for those who I didn't get a chance to introduce myself, I'm Ashley Mangum, and I get to serve as the Director of Kids Mental Health Pierce County. And to see this program expand in the way and communities making it own and all the buy-in, it's amazing to see. And what we do know is that we can't do this work in silos. We can't do it alone. And so it's absolutely amazing to see so many partners here today that will help us link these resources further into the community. One thing that I would highly recommend all of our partners, if you have not got the opportunity to see the Kids Mental Health Pierce County website, it's going to be an awesome resource where you can get linked directly to your regional partner for you to be able to connect mental health washington.org. And maybe I could pull that up on a screen for all of you to see. All right. And if this isn't the power of community right here, one of our computers go out and the other one steps in to see how we can help out. But this is an absolutely amazing resource where you can, again, see some of the resources that are coming from the state, really be informed about any of those legislative changes. And then also, again, being connected right to your regional partners. You know, we wanted to make this as accessible as possible and make that link right to your community. We know what works in Pierce isn't going to work in other communities, and what's going to happen in Spokane is going to work in Salish. And so really making this their own community response was really a priority in rolling these programs out. So again, if you come to this website, you can be linked right to your regional partners. I'm always impressed in these websites. Sometimes I'm like, Vanessa, let's look at what Greater Columbia is doing and see how we can make those changes in Pierce, and really creating that space where we're always learning from each other. But just an amazing, again, a portal to an updated resource. I know we all make these updates on at least a monthly basis to keep this as informed as possible and being connected to those other regions as well. And so really excited about this opportunity and the partnerships. And I hope that you tell a friend when you leave here and you check out this website, and you could share this information as far as possible. And I see Gina's back, so I will hand it back over to you.
We sure are. Thanks, Ashley. Where did you get to leave off before I got booted?
So what's next? You're in the middle of some really great words.
Which parts?
The what's next.
Oh, the what's next. Yep. So we're going fully statewide, which we're really excited about with our North Sound and our King partners that are coming online. We've got this data that we're collecting that we're going to be able to implement, adapt, and use for, like I said, those legislative pieces, for policy recommendations, targeting some training, and just figuring out what kind of outreach we want to focus on statewide. Those are really exciting for us. So what we really want to do is just implore you for a call to action is get engaged, is make sure that you're reaching out to Kids Mental Health Washington's website so you can learn about the the resources in your community. Make sure you're connecting with those teams across the state, all 10 of them that are going to be fully online July of this year, so that you can have a consult for a multidisciplinary team meeting and get engaged in those committees. Be part of the MDTs so that you can refer families, so that you can learn about some resources and collaborate with providers in your area, and also be a part of those steering committees so that how we can add an infrastructure and capacity to the great work your organization is doing, we can do that in a coordinated community-wide meeting. So we just wanted to thank you so much for being a part of our program here today. Thanks for bearing with us through some tech issues, which I think we all know about in this 2024 era. And I could stay on for a couple more minutes, but if you've got questions, please drop them in the chat and we'll be able to respond and follow up that way. Thank you guys so much.